Eating disorders are characterized by an abnormal attitude towards food that causes someone to change their eating habits and behavior. A person with an eating disorder may focus excessively on the weight and shape, leading them to make unhealthy choices about food with damaging results to their health. Although eating disorders tend to be more common in certain age groups, it's not uncommon for eating disorders to affect people of any age. Around 1 in 250 women and 1 in 2,000 men will experience anorexia nervosa at some point. The condition usually develops around the age of 16 or 17. Bulimia is around 5 times more common than anorexia nervosa, and 90% of people with bulimia are female. It usually develops around the age of 18 or 19. Binge eating usually affects males and females equally and usually appears later in life, between the ages of 30 and 40. Because of the difficulty of precisely defining binge eating, it's not clear how widespread the condition is.
Eating disorders, it's some sort of food and feeding disorders. Eating disorders can deviate in several symptoms and several disorders too. One of them, anorexia nervosa. Anorexia nervosa, it means that there is distortion in the perception of body, because most people who suffering from anorexia nervosa perceive themselves that they obese, while in the reality they are very thin and they has lack of weight in a very severe way, so that they perceive themselves that they are overweight and obese, and started to make diet while they are in the reality completely losing their weight. Moreover, they has a risk factor to get death or die because they lack of appetite and the lack of eating. Another thing, or another type of eating disorder, we can find the bulimia nervosa. Bulimia nervosa, we can find that the patient overeating some sort of food like carbohydrate or like chocolate or sweets, and then induce vomiting because he afraid to get weight or to gain weight. Another thing, what we call obesity. And the obesity has been removed from the diagnostic and the statistical manual of psychological disorders, 5 editions. Because obesity, it's have a variety of derivation. We have an overweight, we have a mild obesity, and moderate obesity, and severe obesity.
Bulimia nervosa is the most common type of food disorder or eating disorder. Recurrent craving of eat and followed by compensatory behavior as compensatory behavior as intake laxative or fasting, over exercise to avoid or to begin fat or obesity or overweight.
Eating disorders, the most common kinds of eating disorders are anorexia nervosa and bulimia. They're 2 different kind of disorders. The anorexia would be a severe restriction of food, normal dietary, a severe restriction of food in your normal dietary regime. Person would be concerned that their body was getting fatter, the appearance was not something that they liked. What would happen in anorexia is that even though somebody could be at a normal shape for their age and their height, they actually look at themselves in a different way than other people would look at them. So they focus on one particular area and think that they're too big, or that particular area is too big, and they will then restrict their eating and possibly engage in quite extreme exercise regime as well to lose weight. So the restriction in eating is to lose weight, and the exercise is to lose weight as well, because they're unhappy with the body shape.
Prevalence of anorexia nervosa. The prevalence of anorexia nervosa, it's much more common in females in comparison with males. We can find that patients who are suffering from anorexia nervosa in females or young females.
For the gender-related differences in the diagnosis of eating disorders, the condition is usually more prevalent among females, usually young females.
Eating disorders include a range of conditions that can affect someone physically, psychologically, and socially. The most common eating disorders are anorexia nervosa, when someone tries to keep their weight as low as possible, for example, by starving themselves or exercising excessively. Bulimia, when someone tries to control their weight by binge eating and then deliberately being sick or using laxatives. Binge eating, when someone feels compelled to overeat. Some people, particularly young people, may be diagnosed with an eating disorder not otherwise specified EDNOS. This means you have some but not all of the typical signs of eating disorders such as anorexia or bulimia.
The definition of beauty differs from one culture to another. Some cultures look to the slim lady as more beautiful, Some cultures look to the chubby ladies more beautiful. And again, the definition of beauty differs from one age to another, different from a century to another century. For that reason, the definition of abnormality or the period of between normality and abnormality need to be demarcated very well to specify what's the normal versus abnormal. In general, there is a specific numbers or percentage, as we have discussed in this program, but I mean the cases in between, we need to specify. The other thing, sometimes not only the social reasons, but the personality factors, the obsession and anxiety personality, with some social definitions, with mild form of the eating disorder, either with obesity or over slimness, it may complicate the picture.
Feeding and eating disorder, characteristic by a severe and persistent disturbance in way of eating and the absorption of foods, and the significant clinical signs and symptoms related to body image and related to thinking of eating and thinking of gaining weight or even losing weight. The main diagnostic criteria in eating disorder that there is a problem and disturbance in way of eating and in thoughts of eating, and the patient negatively affecting his behavior on his emotions and in his mood too. If the eating behavior occurs in the context to another medical condition or mental disorder, it will not be diagnosed as an eating disorder. Perhaps we found lack of eating or lack of appetite in patients who presented depression episode. Well, you have to ask yourself at this issue, what is the main primary and what is the other secondary? The primary is the depression. Then one of the symptoms of the depression or depression episodes is lack of appetite and perhaps reducing of weight or weight loss. But what is the main problem, or what is the primary and where is the secondary? If the secondary where the lack of weight, so you cannot characteristic the diagnosis to eating disorder. You may looking for another criteria or another diagnosis, but if the primary episode started by a condition of eating or a condition of obsessive thoughts concerning eating, concerning losing weight or gaining weight, so you may go through the diagnostic criteria of anorexia nervosa or bulimia nervosa.
Anorexia nervosa is usually a condition in young women with marked impairment or marked distortion of body image, pathological low weight as well as weight loss behavior. Such kind of condition is very severe, and the diagnostic criteria of such condition includes the low body weight, the usually self-induced vomiting. Self-induced vomiting is a very prominent feature of such diagnosis. And also there should be a distortion of the body image. Endocrine abnormalities are considered to be one of the diagnostic criteria for anorexia nervosa. And one important diagnostic issue also is the arrested or delayed puberty. As we said, such condition is very prominent among females, usually young females. And the endocrine abnormalities and the arrested puberty are considered to be part or an important part of the diagnostic criteria for anorexia nervosa.
Anorexia nervosa, it's mean a significant low body, that the patient has some sort of disturbance in his perception, or you can say body image distortion. The patient have impairment in his perception to himself and to his body shape. The patient thinks that he is overweight, while at the reality the patient is completely suffering from a significant low weight and low body, perhaps negatively affecting on his basic biological functions such as heart, pulse, and respiration and blood pressure.
There is certain diagnostic criteria for anorexia nervosa, as well as there is also certain diagnostic criteria for bulimia nervosa, according to the diagnostic and statistical manual. For anorexia nervosa, actually, there should be always refusal to maintain the body weight at or above average expected, actually, for the normal weight, provided the age and as well as the height. Such refusal to maintain the body weight should always be marked by intense fear of gaining weight. Clients may be underweight, but they have intense fear usually of gaining weight, and such disturbance in the way that body shape and image is experienced should also cause distress for clients. In post-menarchal ladies, the absence of, there should be always absence of 3 consecutive menstrual cycles. We have 2 types of anorexia nervosa. We have the restrictive type, as well as we have the binge eating purgative type.
Eating disorders are often blamed on the social pressure to be thin, as young people in particular feel they should look a certain way. However, the causes are usually more complex. There may be some biological or influencing factors combined with an experience that may provoke the disorder, plus other factors that encourage the condition to continue. Risk factors that can make someone more likely to have an eating disorder include having a family history of eating disorders, depression, or substance misuse, being criticized for their eating habits, body shape, or weight, being overly concerned with being slim, particularly if combined with pressure to be slim from society or for a job. Certain characteristics, for example, having an obsessive personality, an anxiety disorder, low self-esteem, or being a perfectionist. Particular experiences such as sexual or emotional abuse or the death of someone special. Difficult relationships with family members or friends. Stressful situations, for example, problems at work, school, or university.
Causes for eating disorders vary. In young people, the causes around unhappiness with body shape, but can go further than that, general unhappiness about life. And what can typically happen is people are very focused on, people with eating disorders can be very focused on achieving goals, can have a typically very perfectionist type of view on life, and if in times of stress things are not going their way, they change their eating pattern, focus on eating pattern as a way of coping with the stress of things that are going on around their life that they're not so in control of. So eating is an activity that they control better. So within anorexia, the control is to become more restrictive. In bulimia, the control is slightly different. You eat more calories, but you control the calorie consumption by eliminating the food that you've taken on board.
If it's not treated, an eating disorder can have a negative impact on someone's job or schoolwork and can disrupt relationships with family members and friends. The physical effects of an eating disorder can sometimes be fatal. Treatment for eating disorder is available, although recovering from an eating disorder can take a long time. It's important for the person affected to want to get better, and the support of family and friends is invaluable. Treatment usually involves monitoring a person's physical health while helping them to deal with the underlying psychological causes. This may involve using self-help manuals and books, possibly under guidance from a therapist or other healthcare professional. Cognitive behavioral therapy, CBT, therapy that focuses on changing how someone thinks about a situation, which in turn will affect how they act. Interpersonal psychotherapy, a talking psychotherapy that focuses on relationship-based issues. Dietary counseling, a talking therapy to help people maintain a healthy diet. Psychodynamic therapy, counseling that focuses on how a person's personality and life experiences influence their current thoughts, feelings, relationships, and behavior. Family therapy, therapy involving the family discussing how the eating disorder has affected them and their relationships. Medication, for example, a type of antidepressant called selective serotonin reuptake inhibitors, SSRIs, may be used to treat bulimia, nervosa, or binge eating.
For the drug treatment, we usually depend on antidepressants. The selective serotonin reuptake inhibitors are the drug of choice. Sometimes we may need to use small doses of major tranquilizers because the overvalued ideas regarding the body weight sometimes needs more severe pharmacological intervention. But primarily we use the antidepressants, specifically the selective serotonin uptake inhibitors.
Behavior modification for eating disorder would involve looking at a person's relationship with food. So for instance, people with eating disorder typically are very knowledgeable about the calories that each food contains and how much calories they need per day in their body to lose weight or maintain weight. So one of the areas that you'd be looking at is to help someone try to eat a little bit more and deal with some of the discomfort, the psychological discomfort of eating more and what they feel might happen. There's often issues around control, so there's some fear around it losing control about an aspect of their life. This particular aspect is eating, so it has to be done with some care and caution. Another part of treatment with eating disorder is the issue around body image and somebody believing that they look in a sense a different way than other people see them, so they may feel that they look too fat or a particular area of their body is too fat and they don't like it and they're focusing on losing weight or changing the shape of that area. So focusing conversations on why they don't like that particular area and thinking about why that's important to them, and then trying to change that and thinking, trying to relate to one's body in a different way, in a more favourable way.
Bulimia nervosa must be evaluated from psychiatric doctor and must be managed by psychotherapist or medical treatment, and the successful treatment is the most.